Hello! Time for another IG Live. Waiting for Samantha. Oh my god, my broken nail. Gotta go.
It doesn't look that bad.
This?
Oh. I mean, it's done better.
No, I was just like out hiking and all of a sudden I looked down and my nail was gone. So I love that for me. But let's invite our guest in.
Oh my god, that is brutal. I feel
Yeah,
like
I have no
also
idea.
too, it's not even like a really like a handsy activity. Like if you were like
Oh.
baking or something, I would get it, you know?
Yeah.
Hi.
How are you?
Good.
Good. We're excited to have you and get into all things healthcare, such an important topic. And we're just super grateful for you to come on. Thank you for being here.
Thanks. It's been a while since I've done one of these, so hopefully I am IG living correctly.
It's looking good so far. I'm glad we're on the same page, but we can just get right into it. I don't know, Sam, if you want to kick us off? We're going to talk healthcare today.
Especially since there are some deadlines coming up for open enrollment and all of that. I know we really wanted to cover this. This is something that's super confusing to me. It's confusing to everyone. Healthcare in the US is just like
crazy.
With honestly, like speaking French here, it's a shitstorm. So we obviously want to try and make it a little bit more simplified and just get at least like some basics. But before we get into it, of course, for our audience, whether they're viewing now or, you know, sort of saving it for a later date, we of course want to give the floor to you first and introduce yourself and give us sort of your background in the intersection of healthcare and politics.
Yeah.
Great. Well, my name is Laura Packard. I live in Denver, which is where I'm at right now. And I am the executive director of Healthcare Voter. I also founded a nonprofit called Healthcare Voices, and I have a show on ACT TV on Mondays at 4 o'clock Eastern. And so Healthcare Voter holds elected officials accountable for however they vote on our healthcare. Healthcare Voices, I designed it to help people tell their own healthcare stories for advocacy. And then my show on Mondays is where we have experts answer people's questions. So, you know, some of my work has to do with helping people deal with the system we have. And some of the things I work on are to make a better world so that we can all have healthcare.
A little bit of this, a little bit of that, which both are important if we're ever going to make any moves anywhere. But speaking of the system that we are in right now, better or worse, obviously healthcare front of mind. What are two things that you think that people that are looking to get health insurance on their own should really know right now? And honestly, even in the future, maybe this is even a next year thing too, something that would be just really helpful to have on hand.
Well, open enrollment for the Affordable Care Act is going on right now through January 15th. And that means if you don't have health insurance and you're under 65, you can go to healthcare.gov and go through the process to get covered. Now, if you're under 26, you may have insurance through your parents, but it may not be very good, or maybe you don't have that coverage. So at any age, you may want to go to healthcare.gov and at least see what your options are. And there is free help available because insurance is hard.
Oh my God, it's so hard. And I have so many questions under the sun about how it goes. I am about to turn 26 next year. So there's that monster looming over my head. But can you also maybe explain, like, what is open enrollment? Like, kind of bringing this into, like, our podcast, I Have a Stupid Question segment, because this is a term you hear so much, but it's kind of confusing of, like, what it really entails, who it's for.
Okay, well, open enrollment just means that it's time where you can sign up or you can switch plans if you already have coverage. So if your employer offers health insurance, they usually have open enrollment at the end of the year, so maybe October, November. And with the Affordable Care Act, it runs from November 1st through January 15th. So open enrollment just means that it is time to switch or sign up. And unless you have a specific reason, you probably can't sign up for health insurance outside that time. So if you wake up on January 16th and realize that you want health insurance, you might have to wait until November before you can get it.
That is wild. From like a policy perspective or anything, like, is there a reason for that? Like, does that benefit anyone? Because I feel like that is just horrible, personally.
Benefits the insurance companies. I mean, the reason why they would say this is important is because if nobody, if you could sign up for health insurance at any time, then maybe you wouldn't get it if you were healthy when you would wait until you got sick to sign up. But I mean, that's kind of a silly idea, I think, because you never know when you're going to get into a car accident, or like you can't predict what's going to happen to your health. So I think insurance companies are overselling that. But that is the way that the system is right now. Although if you are very low income or have no income, you may be eligible for Medicaid, and that has enrollment throughout the year.
Okay. And if you were to offer somebody like me advice who's turning 26, like what would you say are like my kind of main options, like really broken down, like and simplified, like what are options once I turn 26? Where
First, does your employer offer health insurance? Because that is often the best deal. If they don't offer health insurance, or if it's really bad health insurance, you may be eligible for subsidies through the Affordable Care Act. So check with your employer first. Then go to healthcare.gov, and it walks you through the process of, you have to estimate your income for this year. But if you are eligible for Medicaid, low cost or free healthcare based on income, it should tell you that. So just going through this process will tell you what you're eligible for.
That is super helpful because my first job out of college, I had like the worst health insurance. Like it was terrible. Like the worst of the worst. And on top of it, I had to pay, even though like it was through my employer, I was paying for the majority of it. Like I think they paid like $10. Like it was ridiculous. And that was just like so insane. And it didn't really make any sense. But because I had to kind of do it through my employer, I thought I did. I didn't know that there was like other options that I could look into. So this is like very helpful that there are other routes. Like just because your employer offers insurance doesn't mean you have to go with that plan or, sort of their mechanism for it. Because I know I felt so stuck and I was like, all right, yay, there goes 90% of my paycheck. Cool, cool, cool.
Well, most people are eligible for subsidies through the Affordable Care Act. So if you go and you look, it'll tell you how much it costs and how many credits you get to help pay for it based on income. If your insurance through your employer is not good insurance, there's various tests, that's when you'll be eligible for subsidies through the ACA. But if you do have health insurance through the employer and it's considered good insurance, then the ACA may not be a good deal for you because you won't get those credits.
Makes sense. Is there a way, like I know you just said there's like a test for like good or bad insurance. Like obviously I have my own opinions. I'm sure Maddie has her own opinions on this too, like what we think is like qualifiably, good insurance. But what is like the litmus test for that?
That's a good question, and I don't have an answer for you off the top of my head, but I would go to healthcare.gov and poke around in there.
Okay. Love it. We love this resource. This is super key.
No, totally. All the resources possible. And like to kind of wrap this conversation up, if you want to lay out any resources you haven't mentioned or any other tips for people kind of entering the space, and you hear about the Affordable Care Act so much, but like, does anyone really know the details? Not really. So like, for people like walk away with like some final resources and just like tips for how to navigate this healthcare.
Okay, well, start at healthcare.gov. Some states have their own state-based exchanges, and it'll route you to the right place if you have a state that does things a little differently. And also, there's an 800 number on the website, and you can find local people to talk you through it. Since we still have a week and change until January 15th, there is time for you to find somebody to talk through all these things and make sure you get the best plan. And I mean, I do all this healthcare policy work, and I still work with a broker to figure out what is the best plan for my specific situation. And
That
it's
makes
free.
me feel so much better about it.
Yeah. Totally. Well, thank you so much for coming on. And is there any way like people can reach out to you if they have questions, or like any other plugs that we can push out there for people about you and the work you do?
Absolutely. Well, you can find me on Instagram at Laura Packard Activist. I'm also on Twitter and all the social medias. Another place that you should go to is younginvincibles.org. They are specifically aimed at people under 26, and they have lots of resources on their website, help for thinking through health insurance for young people and so on. So that is a free resource. Go to younginvincibles.org and go to healthcare.org and healthcare.gov and find somebody local to help talk you through it if you have any questions. There is time. You still have a week and a half.
Amazing. Well, such a crucial conversation. The time is ticking, but now hopefully people had some questions answered. So thank you again for coming on. This is super helpful.
Thanks. And I'm a cancer survivor, and my insurance I had paid for the care that I needed to save my life. So you never know when something's going to happen. You may be healthy right now, and something could happen tomorrow. So get covered.
Totally.
Absolutely.
Well, thank you again. Have a good one.
Bye.